This lecture is an introduction to the opioid drug buprenorphine and a discussion on how best to use this in small animal veterinary medicine. Right, so buprenorphine, it is a semi-synthetic, highly lipophilic opioid. It's considered a partial agonist, which means it partially binds to the mu and the kappa receptors in the nervous system. It's mostly used in veterinary medicine for the treatment of mild to moderate pain, such as the pain that you would find with an ovariohysterectomy, in dogs, cats, and rabbits. It provides pain relief for several hours duration, and it is an excellent pain relief medication due to the fact that it has very few side effects. So I mentioned on the previous slide that buprenorphine is classed as a partial agonist. The difference between a partial agonist and a pure or full agonist, like morphine, methadone, and fentanyl, is the effect that the binding with the mu receptor elicits. So morphine, a pure agonist, has a very high efficacy to the mu receptor, and it binds to a lower proportion. Contrast this with buprenorphine that has a low efficacy but high affinity. So it'll go to a lot of the receptors but only yield a partial effect with the binding. I'm going to just highlight buprenorphine on the screen here. There we go. So we've covered what a full agonist is, morphine. We've covered a partial agonist. I've also listed here naloxone, which is an antagonist. So it's a reversal for both pure and partial agonists. And finally, a mixed agonist-antagonist, so butorphanol, which is often used for sedation in small animals. It antagonizes the mu receptor, but it is an agonist at the kappa receptor. So a little bit more information here for those of you that want to know the details of the mechanism of action of buprenorphine. Activation of a mu opioid receptor, so by the binding of buprenorphine to it, inhibits the presynaptic release and the postsynaptic response to excitatory neurotransmitters. This ultimately leads to blocking of substance P being released. Now, substance P plays a big role in nociception. So if there isn't substance P, it means that there's a prevention of the sensation of pain produced by brain chemicals. Right, so clinical use. Buprenorphine is presented as an aqueous injectable solution. It comes in two different forms. One is a 1 ml vial that does not contain a preservative. The other is a 10 ml multi-dose bottle that does contain a preservative. I've put a picture of a common UK brand, Vetergesic, on the side of the screen, but there's many different brands available of buprenorphine. A little note on concentration. So the most common concentration is 0.3 milligrams per ml, but please be aware that other concentrations do exist, so check this before use. The dose for dogs and cats is 0.01 to 0.02 milligrams per kilogram, and this can go a little bit higher for rabbits, up to 0.05 milligrams per kilogram. Always consult a drug formulary for doses for other species. The beauty of buprenorphine is that it can be given in many different ways. So intravenously, intramuscularly, subcutaneously, and in cats, transmucosally. So buprenorphine lasts about 6 to 8 hours in our veterinary species, and the onset of action is about 15 to 20 minutes. It's useful for two applications here, both as a use prior to a noxious stimulus, so this is called preventative analgesia, and also as a postoperative or maintenance long-term analgesia. So it could be given before pain and during episodes of pain. An example is a dose of 0.02 milligrams per kilogram buprenorphine combined with a nonsteroidal anti-inflammatory has been recommended as a good protocol for surgical and postoperative pain relief for ovariohysterectomy. A quick note on transmucosal use. I mentioned this with cats. The pKa of buprenorphine is very similar to the pH inside a cat's mouth. So this allows for nearly complete absorption buccally, so through the mouth, through the cheeks. The metabolism of the transmucosal administration is nearly identical to intravenous or intramuscular use in cats. Unfortunately for dogs, it's not as efficient, so about 40% of transmucosal absorption compared to cats. So this is a good one to keep in mind for cats that are difficult to stab. You can get clients to take buprenorphine home and give it orally, so transmucosally, for continued pain relief. I've just made a slide here about a depot kind of slow release subcutaneous dose that can be used in cats, in case anyone's not come across this before. I've put 3 studies there that you can look up that I'm referenced at the end that discuss the sort of best doses to do this and the duration of action when you give this long dose. But in short, a dose of 0.12 milligrams per kilogram sub-Q, so quite a high dose if you think about that we're normally giving 0.02 milligrams per kilogram. This is a much larger dose. That this provides 24 hours of effective pain relief with minimal side effects. So other than a bit of mydriasis, so enlarged open pupils, the cats are very comfortable with this 24-hour injection. I personally have used it for 24 hours of pain relief for patients that are waiting to have perhaps a limb amputation the next day or a fracture repair done the next day. For some cats that are quite fractious and difficult to medicate, being able to give a one-off injection that you know will provide 24 hours of pain relief is a great tool to have with your different analgesic protocols that you use. A very important point needs to be made on dose timing, especially when you're considering using either a full or a partial mu agonist. Now, methadone and morphine aren't available in every country, but if it is available somewhere that you're working and you have an animal that presents to you where you think that you will want to use the beneficial effects of a full mu agonist, so for example, an animal with a fracture, and you think, okay, in the next hour or 2, this animal is going to be given a full mu agonist like methadone or morphine for strong, efficient pain relief, do not give that patient buprenorphine, as the buprenorphine will be occupying many of the receptors that in 1 to 2 hours you might want your full mu agonist to be occupying. So always have that in mind, and do not administer a partial agonist like buprenorphine if you're intending to, within a few hours, use a full mu agonist. I would say, though, do not delay if you have given buprenorphine and you don't feel that the pain relief is sufficient or adequate enough for your patient. Do go ahead and give that full mu agonist, because there still will be some receptors that are not occupied that will have the benefit of having additional opioid pain relief. So let's talk about side effects here. The great thing about buprenorphine is that there's very few side effects. I'll start first with cardiovascular effects, negligible. So your veterinary nurse or your veterinary assistant won't be appreciating many changes with their anesthetic monitoring due to the opioid, which is great. Opioids also can be used for very sick, very unwell patients, including patients that possibly are in shock, that have been involved in a road traffic accident. There's no reason to not give these pain relief medications if they're available to even very sick or very unwell animals. A benefit as well with buprenorphine is that it rarely causes some of the side effects that are seen with full mu agonists, so such as vomiting and dysphoria. The most common side effects that you might see will be a mild sedation, mydriasis, so those sort of dilated open pupils, and sometimes a transient pyrexia, so an increased temperature. This is mild to moderate and self-limiting. For cats with the depot subcutaneous dose that I mentioned before, it's important to let clients know, or for you to monitor yourself if the cat is in your hospital or under your care, that these cats will need to have a lubricating eye drop to help with the drying or desiccation of the corneas. But besides these few side effects, there's nothing else really with buprenorphine, making it an excellent choice for nearly every case that I can think of that needs pain relief. There's no contraindications to use buprenorphine with other specific medications. It's oftentimes combined with lots of other medications as part of surgery protocols. What I will note though is that buprenorphine does cross the placenta and may have sedative effects on neonates born to bitches and queens treated prior to parturition. So if you are going to perform a cesarean section, it's best to delay giving buprenorphine to the bitch or the queen until after the kittens or puppies have been born. It's also something to think about whether or not you have the antagonist naloxone at your practice that can be given. Uh, there are some reports of the multi-dose injection being painful on intramuscular injection, so keep that in mind. And as I just mentioned before, oftentimes buprenorphine is used as part of anesthetic protocols, so it exerts this positive drug-sparing effect, which is a good thing. It means oftentimes smaller amounts of other medications are needed in harmony with buprenorphine. And the last sort of point here as a warning is that buprenorphine has a ceiling effect. So ceiling effect, the analgesic effects will not become more pronounced at higher doses. And actually higher doses may actually decrease the pain relief effects through displacement of normal endogenous opioids. So don't just keep giving buprenorphine if you don't think it's having a good enough effect. I'll finish here with a couple of example drug protocols and doses that can be used. So for pre-medication for surgery, buprenorphine can be combined with many different medications. So at the DogStar Field Clinic, we can combine xylazine or medetomidine, so alpha-2 agonists, with buprenorphine as a IM injection about 15 minutes before inducing anesthesia with either ketamine or propofol. You can also use buprenorphine with acepromazine, and you can also use buprenorphine with a benzodiazepine like midazolam, especially if you've got a very sick or a very old patient. That's an excellent protocol. A little bit of pain relief and a little bit of midazolam, perfect. You can also use buprenorphine as part of the quad protocol, so equal volumes of medetomidine, ketamine, midazolam, and buprenorphine for young and juvenile kittens. And finally, you can use buprenorphine not as part of a anesthetic protocol, but as we've discussed previously, as just pain relief on its own. So 0.02 milligrams per kilograms for many medical conditions and for post-operative pain relief. Thanks for listening. Here are some of the sources I used to write this lecture. Hope you have a lovely day.